Welcome back to CTV Morning Live. We have paged Dr. Paul, the Eastern Ontario, the Health Unit CEO, the Medical Officer of Health. There's like a long title for your name. I always do that. All right, so oftentimes we talk a lot about kind of the kids. We are going to a different spectrum today. We're actually focusing on seniors, and we're looking at fall prevention.
Yes. One of the things that we've noticed, both locally and provincially, actually, if I just tell you the numbers, $1.7 billion a year is attributed to seniors falling in hospitalization costs. That's a $1.7 billion.
Billion, yeah. It's a B.
Yeah, a billion. And that translates into many seniors falling at home or in an institution, breaking their hips or knee, and requiring hospitalization. And what we also look, when we look at our partner hospitals, the majority of their beds that are taken up for more than a week or two are taken up by seniors who have fallen. And so we've worked locally and provincially. I co-chaired a provincial committee that looked at falls programs across Ontario. And we worked at getting an integrated approach in preventing falls, because obviously if you can prevent a fall, you're not only going to prevent healthcare costs, but also the severe disruption and actually severity of it. Some seniors who break their hips have a higher rate of mortality. They can die from it. And notwithstanding the fact that they lose several months because it takes them a long time to rehabilitate. So what we tried to do is we tried to look at the prevention aspect of it, which starts from multiple spectrums. So the most logical thing to do is, if you're a senior or taking care of a senior, obviously looking at the home setting, making sure that there are no carpets that are loose or wires that are loose in terms of prevention at home, tripping hazards and those type of things. So it's very important to evaluate your home that way, just like you would for a child in terms of childproofing.
It's almost like you're childproof your house. You're doing the same thing from a different angle.
Exactly. And so looking at the bathrooms, railings, and those type of things, slip-proof mats for the bathroom and so on. That's one of the things that we talk about. When you're talking about winter weather like this, obviously making sure that the stairs and the driveway are clean, protective shoes. If they have a cane, there are also these spikes and spokes that you can put on. So those are the type of things that we talk about in terms of awareness, because you can make a big difference. But if you don't fall, you don't break your hip, and you can do well. The other thing that we look at is sort of a lifestyle change, and it's never too early to start in terms of building your muscle bulk and making your bones stronger. And so exercise and eating calcium and those type of things are quite important, even at a young age. And so when we work at our health unit with long-term care homes and senior homes, we actually give them programs in terms of making sure that people have their balance, balance exercises, stretching exercises, muscle bulk exercises, and everything to sort of increase their bone density to be able to offset a fall. And then what we also do is we work with other healthcare professionals where we ask them to screen any of their patients that come in for fall risks. For example, do they see well? Do they taking medication that makes them dizzy? Those type of things. Do they have a gait problem, neurological problem? So we're looking at all spectrums, and we're working with long-term care homes themselves to make sure that they have approaches when they go from bed to chair and so on. So it is an integrated approach, but I think the bottom line is, for people listening today, is really prevention is the best thing to do. This is a big problem that people don't realize, and it's in the billions in terms of...
Well, when you say 1.7 billion, you realize that this is,
a tremendous cost.
A tremendous cost, and that there are preventative measures.
Exactly.
And you take the opportunity to install a railing, to install things into house-proof, do the check around the house.
Exactly. That's the most important thing. And as a prevention for long-term for us, me and you and everybody else, exercise and building up the bulk of the muscles and making sure that your bone strength is up there is the best thing you can do.
Always a pleasure. Great information, and often just a really key reminders for people that they just kind of rethink it.